This week on Healthy Living, it is underreported and can cause serious harm. We take a look at medical misdiagnosis. To what extent should medical practitioners be held accountable for medical errors? Your answers coming up. And some insights on why you should get a yearly physical exam. Plus, we visit a musician in Dakar who has joined the fight against COVID-19. These stories and more in this edition of Healthy Living. Hello, Happy New Year to you. I'm Linor Moudou. Thank you for joining us on Healthy Living. Diagnosis is one of the most important tasks performed by healthcare providers. However, a report from the Institute of Medicine in the United States titled Improving Diagnosis in Healthcare concluded that most people will likely experience a diagnostic error in their lifetime. Experts say millions of people around the world are misdiagnosed every year, leading to wrong treatments and causing harm to patients, sometimes death. Medical misdiagnosis may involve delayed diagnosis, wrong diagnosis, missed diagnosis, or failure to recognize complications that alter or worsen existing conditions. The World Health Organization has included diagnostic errors as a high priority problem in primary care patient safety. Let's go to Kenya, where the country's medical practitioners, pharmacists, and dentists union have raised the red flag over the increased cases of disease misdiagnosis, blaming it on policies that allow unqualified staff to conduct tests on patients. Huba Abdi from Nairobi reports and Grace Oyenyubi narrates.
For 12 years, Caroline Nyambura has been blind because of misdiagnosis, which led to her being treated for a disease she never had.
They treated me for malaria. They gave me an injection and other medications for malaria. I used those medications on Sunday, and then on Monday I blacked out, according to my parents.
As her health kept deteriorating, Nyambura had to ask for a second opinion from different doctors. And after several tests, she was diagnosed with meningitis.
I went to the third hospital, and as soon as I arrived there, the doctors looked at me and said, "This is meningitis." They were very angry at the previous doctors who treated me. They did necessary tests and confirmed that it was meningitis, and it was at a very critical stage.
Even after the treatment and doctors trying to help as much as they could, Nyambura lost her eyesight. Dr. Benjamin Jihir says, if being treated late, meningitis can cause irreversible effects.
For example, meningitis affects the membranes that protect the brain and spinal cord. If meningitis is not treated at the right time, then it can spread and affect many other parts of the body.
In 2019, Kenya National Union of Medical Laboratory Officers Secretary General Enoch Wanyoyi said misdiagnosis cases are on the rise, as most of the diagnosis work has been left to pharmacists and biology teachers, while this should be left to lab technicians. Secretary General of the Kenya Medical Practitioners, Pharmacists and Dentists Union, Devji Atela, says the situation needs a closer look, as 3 out of 10 patients in Kenya get the wrong diagnosis or treatment.
We have shortage of doctors in hospitals and in rural facilities, in level 3 or level 2 facilities. And not everyone wearing a white jacket is a doctor. That's why we have so many cases that are reported as negligence or misdiagnosis.
Dr. Jihir is advising health workers to not hesitate telling patients that they need to seek more advice in other hospitals.
Advise them to go to another hospital which is a level above us so they can diagnose it properly if we aren't sure. You don't want to give patients medication for the wrong illness.
Even though she is angry, Nyambura said she has accepted her condition and hoped that others will not go through her experience.
Dr. Usman Galadima is a kidney specialist at the Department of Internal Medicine, University of Abuja Teaching Hospital, Gwagwalada, Abuja. He elaborates on some causes of medical misdiagnosis and what can be done.
Almost every illness can be misdiagnosed. Statistically, women and younger people top the list of those that are misdiagnosed. The doctor could be handicapped, of course, because the kind of test we want to do may not be available. This causes a lot of frustration. We've had reasons to send samples out of the country, and this may take up to 2 weeks. If they were available, could be maybe within a day. A patient could have headache or fever, and then he goes to a lab and says, do tests for typhoid for me. There is no proper consultation or presentation to the doctor. The laboratory scientist does the test and tells him that the result is positive. And then the patient goes again to the pharmacy and gets his drugs for typhoid. Meanwhile, it could be malaria that he has. Usually, those illnesses that are commonly misdiagnosed are those that are rare or not within the confines of experience of the doctor. Patients should know that they have the right to ask questions, to seek, to be involved in their treatment. You should be able to get more information from the doctor. If you are not satisfied, you seek for a second opinion. Cost is a major factor. Where there is universal health coverage for everyone, you can carry out as many investigations as possible without trying to save costs for the patient. We'll have to do something about retaining doctors in the country. Just about 24 to 30,000 doctors are practicing in Nigeria currently, taking care of a population of 200 million. How do we solve these problems? If you remove the financial burden for seeking healthcare on the patient, more people will come to the hospital. Hospitals will be better funded. More equipment will be available. They will be able to hire more specialists and even retain doctors and other health workers.
We asked some people in Nigeria how should doctors be held accountable if they make medical mistakes. Here are some answers.
You hear so many stories of deaths and probably patients who don't get justice.
And when such a thing happens, I believe they have to revoke the license of the doctor in question so that the doctor won't be working at the moment when the case will be looked into.
If doctors should make mistakes, they should be penalized.
So I think one of the major ways is for the hospitals themselves to create bodies that will really enforce and give justice to the patients. And maybe the patients themselves should start taking the hospitals to court.
And depending on the outcome, if it is something that is that serious, probably the person can also be given a jail term if there is need for it.
If a doctor makes mistakes, he should be sentenced to maybe jail or sanction, or he should pay ransom to the patient. I think by then they will minimize their mistakes, because some of the mistakes are just done intentionally and carelessly.
Especially in our government hospitals, you find out the negligence is on another level entirely. I mean, I've experienced it before, so I know how it feels. And I wish for some reason I had spoken out then. Probably I would have gotten the justice I deserve.
For many people, a new year is also the time to see the doctor for a physical examination, even if nothing is wrong. A physical exam is a routine examination performed by your primary care physician to check your general health. It is also known as a wellness check. You don't have to be ill to get a physical exam. According to experts at the US-based Cleveland Clinic, the physical exam is an opportunity for you to touch base with your doctor, discuss any health concerns you may have, and talk about some preventive health tips and measures. Experts say if you are a healthy adult and between 20 to 30 years old, you may have a physical exam every 2 years or so. Beyond that, it is advised to get an annual exam. The frequency of the physical exam may vary depending on personal and family medical history and other factors. The disfiguring disease Noma, found mainly in poor areas of sub-Saharan Africa that lack health care, kills 90% of victims, most of them children, when left untreated. Noma is preventable with awareness, and to that end, aid groups are urging the World Health Organization to add Noma to its list of neglected tropical diseases. Henry Wilkins reports from Kongusi, Burkina Faso.
8-year-old Amadou Compore recently recovered from Noma, a little-known tropical disease that kills 9/10 of its victims if left untreated. Many who survive Noma have facial disfigurement.
We noticed the disease in the run-up to Christmas. To begin with, he said his mouth ached to the point where he couldn't eat anymore. He even had great difficulty drinking sachets of water.
Compore took his son to the nearest city, Kaya, about 25 kilometres away, where medical staff could identify the disease thanks to awareness building by the Swiss non-governmental organisation Sentinels.
In most of Burkina Faso, health workers have no idea about the disease Noma, so diagnosing it in people 400 to 500 kilometres from Ouagadougou is very difficult.
He says that he's sometimes forced to diagnose Noma with photos sent to him via WhatsApp. Odette Serene, who also suffered from Noma, now receives regular follow-up treatment at the Sentinels clinic.
There are people who laugh at me. When they laugh at me, it makes me sad, but the nurse has helped a lot to take care of me.
Noma is just one of many illnesses that are currently missing from the World Health Organization's list of neglected tropical diseases. Doctors Without Borders is running a campaign to have Noma added to the WHO list.
There is, of course, discrimination affecting the patients, and so every time there is a case, we might not even be aware because they are hidden by the communities or they are dying.
The WHO says when it adds diseases to the list, factors like social stigma and death rates are taken into consideration.
It really brings the disease or the condition to another level. If it is category A, then a global program is built around the disease to tackle the disease. It also adds to the advocacy, awareness creation, and also resources.
The WHO plans to make possible new additions to its neglected tropical diseases list in 2023. It remains to be seen if Noma will be among them.
Mobilization to fight against the COVID-19 pandemic has become widespread in the world and in Africa. Artists and musicians have joined the campaign to prevent the spread of the virus through frequent hand washing. VOA visited a musician in the Senegalese capital Dakar. Venus Nshiyimiana reports.
To help prevent the spread of coronavirus, Rwandan singer Manu Ragabo has composed a song called I'm Staying Home.
I composed it when I realized that the situation was worsening with the rapid spread of the pandemic. As it crossed borders, we stopped going to work and we no longer played music in public. I thought I can't continue to sit and watch as an artist. I decided to contribute through this song, I'm Staying Home.
Manu Ragabo says that through his song, he wants to raise awareness against what he called an invisible enemy.
These instructions are about how to wash your hands as much as possible. Another key message is about wearing masks. Finally, those who are able, except key workers like doctors, should stay home without being forced.
The lockdown has affected people's mental health and physical health. They are unable to socialize as they normally would. Some have lost jobs and incomes, making it more difficult to access basic things like healthy food. Health experts keep saying that washing hands and keeping your distance helps to slow the spread, and Manu Ragabo hopes his song will help spread the message.
For the latest news and coverage on the coronavirus, stay connected to Voice of America at voanews.com. You can follow me on Twitter at @LenorMoudou. That's our show for today. Until next time, stay well and strive to make every day a healthy day.